Tennis elbow, also called lateral epicondylalgia or lateral epicondylitis, is pain on the outside of the elbow right here. It usually begins as minor pain that comes and goes, but it can progress to becoming severe and constant pain that bothers you with everyday activities. But no, the tennis elbow goes away nearly 100% of the time with the right treatment. However, typical treatment recommended by healthcare professionals only provides short-term pain relief because it's not fixing the root of the problem. In this video today, I'll be explaining to you the root problem of tennis elbow, as well as talking about the symptoms and treatment options for it. Now let me get right into the root cause of tennis elbow. This is not commonly known. This is not taught in schools right now to my knowledge, but this is through my study what I've come to the conclusion of, and I've treated patients with this in mind, and we've gotten amazing results. If you think of the elbow right here and all the muscles that go from the elbow down into the forearm, through the wrist, all the way to the fingertips, there's muscles on the back part of your forearm and on the front part of your forearm. So this is the back part of your forearm, and this is the front part of your forearm right here. The muscles on this side of the forearm help to flex the wrist this way and close the hand to grip. These muscles come in and attach on the inner part of the elbow right here. Now on the outer part of the elbow, where people get the tennis elbow pain symptoms, the muscles that extend the wrist and open the hand attach right here. When there's a muscle imbalance between those two muscle groups, it can cause shifts in the joint at the elbow, and this is what causes tennis elbow. The shift that I'm talking about is usually at this joint right here. This is the radius bone, this is the humerus bone, this other one right here is the ulna, but the radiohumeral joint right here tends to shift outwards this way. So on your elbow, it can actually feel like there's a bump right here where the pain is that isn't present on the other side. When this shift happens, it moves the bone this way, which tensions the ligaments in the area as well as the tendons. Once the tendons become affected, you can develop tendinitis in this area. It's still called lateral epicondylalgia or lateral epicondylitis. Those are all just medical terms for there's pain and inflammation in this area. But generally, it's all called tennis elbow. Now let me tell you the symptoms of tennis elbow. Of course, pain right here in that area. It's real specific in this area. If it's there long enough, you can get pain in other parts of your arm, all the way up into the shoulder, in some cases, even the neck. It can come down into the wrist and even affect the arm and hands. It can come down into the wrist and even affect the hand and fingers. When that shift happens in the bone, it might affect a big nerve that runs right by that joint. It's called the radial nerve. That nerve comes off the neck, runs down the shoulder, and all the way to these fingers right here. So once that nerve is affected, you can get pain anywhere along that pathway. Sometimes people will say they have a trigger point right in this area right here, not quite where the tennis elbow problem is, but nearby, and that's usually that radial nerve that's very irritated as it passes through some muscles right here in the forearm. Things that will hurt are picking up heavy pitchers, or a pot of coffee is one that we often hear, and pouring it as you turn this way, because it puts these ligaments and tendons in a position where they're more strained than normal. Also lifting heavy pots and pans while cooking, doing cleaning because it's a repetitive activity. Also yard work, like if you're raking, sweeping, anything outside that requires substantial force and repetitive motion, that can definitely aggravate the elbow. And then weightlifting or other exercise that involves the arms, because there's force involved in repetitive motion, that also tends to affect the elbow. Now let me tell you how tennis elbow is diagnosed medically. When you go to the doctor for this problem, they're going to hear your story, and if you've got similar to one that I've described, then they're going to probably diagnose you with it. They may also do a physical exam where they feel your elbow, check the full motion. They may recommend getting x-rays to rule out things like a fracture or cancer. Sometimes they'll want an MRI to get a closer look for cancer or other issues like the tendons and the ligaments in the area. They want to see what those look like. Now there's a low likelihood that you have osteoarthritis in your elbow. The main sign that you have arthritis in your elbow is that you have a loss of motion in your elbow compared to the other side. Like you can't bend all the way, or you can't straighten out all the way. This one is stiffer. Also stiffness in the morning, or if you haven't moved for a while, that's another sign of osteoarthritis. It doesn't typically happen with tennis elbow, although on occasion, very rarely, I do see people with tennis elbow have stiffness because of that joint shift. But if it goes away, if it's not constantly there every day, then it's likely just related to the joint shift and not necessarily arthritis in the elbow. Now, if this is left untreated for years or decades, it can progress to osteoarthritis in the elbow because the mechanics at that joint are abnormal, so the joint will adapt, which makes the joint surfaces rough and not work properly. That's how you get arthritis in that elbow. Common treatment options for tennis elbow include rest. That's one of the first things your doctor will tell you to do. Don't use the arm so much. Pour the coffee with your other hand instead of the one that bothers you. Avoid doing the yard work. Hire somebody, get some help. Try to not cook as much. They'll tell you to just avoid the things that make you hurt in order to rest the ligaments and tendons in the area so that it feels better. They may also recommend that you try icing the area, sometimes heating the area too. They may offer you a brace like this one that you slip on over your elbow and tighten it up. This one has a little pad to put pressure on the area that hurts. In some cases, your doctor might recommend a splint for your wrist to avoid moving the muscles that come down here to your elbow, but they cross your wrist. And they'll tell you to sleep like that at night, especially if you have pain that has gone into your wrist and hand. They may recommend you go to physical therapy as well to begin exercises, and there they may tell you to do activity modification, like getting a different keyboard, an ergonomic keyboard that's split in half so your arms and hands can be in a better position. They may recommend that you use power tools instead of manual tools, like instead of using a screwdriver, use a power drill with the screwdriver tip. And even other recommendations like elbow rests on chairs might be discussed. In physical therapy, you might do exercises to strengthen the muscles of the forearm and wrist and the whole shoulder. General physical therapy tends to be exhaustive in the exercises they do for any given body joint. So they'll do exercises for this side and this side. And like I said earlier, there's an imbalance in the muscles on this side of the arm and this side of the arm. And so you need to strengthen the muscles appropriately so that you don't feed into the imbalance. I'm going to tell you more about this here at the end of the video. Just let me tell you a bit more about common treatments for tennis elbow. Now, your doctor might also recommend you take over-the-counter pain medications. If that doesn't work, they may tell you to take prescription strength pain medications to help the inflammation. They may also recommend a cortisone injection because that will inject the medication directly into the joint, the area where it hurts. And if that still doesn't work, there technically is a surgery for this, but it's rarely done. They'll do it arthroscopically, meaning they use little holes with a little camera and another little tool that they can insert, and they typically will clean out the damaged tendon and ligament in the area that's causing the pain. Now, I have never seen anybody get this surgery before. I've only heard about it. I think it's super rare. And speaking from a mechanical point of view, which is what I specialize in, I think it's a bad idea to do. And if you're fixing the problem naturally, which I'm going to talk about in just a moment, then you shouldn't have to worry about getting the surgery because you're losing tendons and ligaments. Those are important for you to have. It's just a matter of putting them in a position where they're going to heal. But I get it. Some people don't get this information, and so they end up going the surgery route in hopes of getting relief. But be careful. I hope I can get to you before you end up going down that pathway. So let me tell you how to fix the root problem of tennis elbow. Since this is an imbalance between the muscles that flex the wrist and close the fingers and the muscles over here that extend the wrist and open the fingers, we have to consider what that balance should be. Many healthcare professionals will argue that the strength should be the same going in both directions, but I don't think so. I disagree strongly, and here's why. When you close your hand like this, you should have a lot more strength because this is what our hands are designed to do. They're designed to grip things, hang on to things, even hang with your body weight like this. But opening, you can only go so far. Your fingers don't curl all the way back here, normally anyway, and your muscles aren't designed to take you back there with force and extension. Nobody ever hangs on the back of their hands. You hang this way on your hands. Nobody ever grabs anything the other way. You typically grab things this way because that's the way your hand is best designed to do it. Therefore, the muscles that close your grip this way should be stronger, and that's normal balance for the wrist flexors and wrist extensors or finger closers and finger openers of your hand. Your wrist extensors and your finger extensors should only have enough strength to take them through full range of motion without any problems. So if you can go through your full wrist extension like that, then your wrist extensors are strong. That's good. Now, if you have trouble getting there, but you can assist it in getting there, but it just doesn't stay there, then you do technically have weak wrist extensors. Same thing with finger extensors. If you can't fully extend your fingers, but you can push them there, they have the ability to get there, then you do have some weakness in those extensor muscles. But if you can fully extend your fingers and fully extend your wrist, your extensors are plenty strong and there's no need to further strengthen them. In fact, if you do strengthen them more, it's going to feed into this imbalance and shift that joint more and cause a worse tennis elbow problem. Then you know that your flexors are weak and you've got to get stronger this way. Now you can figure out how weak or how strong your grip strength is comparatively from side to side by using a grip strength measuring tool like this one. This is called a grip dynamometer. I'll link this in the description below here. The way this works, though, just to give you a quick overview of it, this will just take seconds. You turn it on, you can read the instructions. Once you turn it on, it tells you the grip strength right there, and it'll mark it for you. You should be within 10 pounds of grip strength from side to side. If your side that's injured is actually significantly weaker, like more than 10 pounds, then it's very obvious that you need to be doing some grip strengthening exercise. And I'll show you how to do that with this in just a moment. So to do a proper measurement with this, you're gonna hold this right by your elbow, make sure it's zeroed out. Then you're gonna squeeze it as hard as you possibly can. And whatever your measurement is, then you compare to your other side. Now we do the best of 3. And if it's weaker on the other side, see, I'm about the same, and I could have gripped harder, I just gave it a quick go. But if it's about the same, then you're technically okay on your grip strength. If there's a difference, especially if it's more than 10 pounds difference, or more than about 2 to 3 kilograms different, then you definitely need to strengthen your grip strengtheners on the side that you have the problem. Now, it is possible that both sides are weak, you've just got symptoms on one side. There are norms by age and gender, and on this specific grip strengthener, they're on the back right here. You can see male and female right here, and it tells you what's weak, normal, and strong. So you can go by that too. I have seen that very often. I have patients coming in and they have nearly identical strength side to side. It's within 10 pounds, but they're weak overall. And we have to increase their grip strength, and we'll follow up with their measurements on this so that we can track that they're improving week to week on doing the right grip strengthening exercise. Now, once you determine that you need to get stronger in your grip strength, here's what you gotta get. One of these grip strengtheners, they're very inexpensive. You can get these online. I got this one off Amazon. There's a link to it in the description below. You can find these at your sporting goods stores as well. And I like these specifically because they're adjustable. You turn the knob right here and it moves the spring closer this way or farther this way, making it easier or harder. So I'm moving it away, the spring is moving away, so it's going to get harder and harder. And the way that you would use this is you grip as hard as you can and hold it for 10 seconds. Now this is too easy because the handles are touching. So I can potentially squeeze harder, but the handles are blocking me from squeezing harder. So I'm gonna turn it more, I'm gonna max it out all the way. And even if I can close it all the way for a moment, that's fine. But you gotta be able to hold it for 10 seconds. So find the right intensity that you can squeeze at, and it should be a struggle without hurting your elbow. Hold it there for 10 seconds and it should feel like it is making you work, making your forearm muscles right here work, making your palm muscles work. Be sure to put this in the right position in your fingers, not at the ends of your fingers, so that you get the right muscles to work, and try not to extend your wrist while doing this. In fact, you might even want to flex your wrist so that you can take pressure off this joint right here. Hold that for 10 seconds, and I would repeat it 10 times as long as it doesn't bother your elbow. And I would be doing this hourly throughout the day until your elbow pain goes away. You should notice that after a few days, definitely after a week of doing this consistently, your elbow pain is improving gradually. Now, it is possible that you have an irritated radial nerve. You might need to let it rest a bit more and not be so aggressive with strengthening. But if you don't have an irritated nerve problem, you don't have pain down the wrist and hand, nothing in the shoulder or neck, you should be able to go full speed into grip strengthening. If you do have those issues, you might need to do some other work first before you can get to this aggressive grip strengthening and really take care of this tennis elbow problem. Hey, if you thought this video was helpful, please give us a thumbs up, and please share this video with somebody you think needs to hear this. Also, consider subscribing and turn on our notification bell so that you don't miss out on any helpful videos we put out every single week. Thanks so much. I'll see you in the next video. Bye-bye.